careers in pharmacy. So we've gone through the application of, the typical pharmacy application. We've gone through, what else have we gone through? Went through like the experience, and what to expect on a MPharm degree. So lastly, we're going to kind of cover careers in pharmacy. So the first one that I'm going to be speaking to you guys about today is being a community pharmacist. So this is one of the most common roles in pharmacy. So these pharmacists in particular, they work as a frontline healthcare workers in local pharmacies, or they can also be in doctor surgeries. So a lot of time when you walk into your local pharmacy, the person that kind of deals with you and kind of advises you is the pharmacist. So they're known as a community pharmacist. So their role in particular is to kind of, advise the patient, dispense medications. So a lot of what they're doing at the back, obviously with their team, is dispense medications, making sure that the dosages is right. It's really important that they keep an eye on the dosages, that they're looking at any interactions with the drugs, because as we know that drugs tend to interact. So it's important to look out for those interactions to make sure that it's safe for the patient to take it. They're also capable of delivering different services, such as they can, do flu vaccinations. A lot of pharmacies can do flu vaccinations. Some of them would kind of have to do just a bit more training, but they are able to do that. They also provide a lot of lifestyle change services. So that kind of includes like weight management, stop smoking services. All of these kind of things is what you would do if you was a community pharmacist. They also work alongside, the GPs, so your general practitioners, and other healthcare professionals to kind of provide, a patient-centered care. So when I say they work hand in hand, you kind of, the patient goes to the GP then sends a prescription over to the pharmacy. The pharmacist then checks the prescription, makes sure it's okay, before safely dispensing it out to the patient, and obviously offering advice alongside that as well. So this role can actually also progress. It can progress into becoming a managerial role. So a lot of pharmacists tend to become managers of pharmacies. You can also become like an area manager, or just simply the manager of that pharmacy. So that's kind of the route that a lot of people take. Being a kind of like a manager of a pharmacy kind of consists of, leading a team, meeting targets as well. Kind of, you have someone ahead of, like, over you, that's kind of, um, trying to develop the pharmacy as well. So that's kind of what community pharmacists do. Next, we're going to look at hospital pharmacy. So as a hospital pharmacist, you're going to be working in either NHS or a private hospital. You're going to be working in a team. So you're going to be working with a pharmacy team, but you're going to be also with other healthcare professionals. So other professionals such as doctors, such as nurses, you can even come across dietitians, various types of people that you're going to come into contact with. It involves you kind of using your knowledge, to provide advice to healthcare professionals and patients. So a lot of times when the nurses give the patients their medications, you would kind of advise the patient, once again, making sure that they're taking it correctly, making sure that the dosages are okay for them. And once again, you want to pay attention to the interactions as well. You're basically going to be advising the doctors and all the other healthcare professionals that they are giving the patient the right thing. That's your role in a hospital pharmacy. It may also include, being able to manufacture, develop, test, and monitor, drugs in the hospital. So you kind of test their effectiveness, and making sure that they're safe for the patient. That's the kind of role that you'll be having as a hospital pharmacist. You also have the opportunity to kind of specialize. So in hospital pharmacy, you have the opportunity to kind of progress in your career. So you don't just stay being, just known as a hospital pharmacist, but you can specialize into specific conditions, such as, you can specialize in mental health or pediatrics or cancer. You can really go into that with a lot of experience. So over the years that you you know, become a hospital pharmacist, you can actually develop into these different things, which is actually quite interesting. There's also, once again, managerial roles, so you can become a manager in the hospital as well. There's also teaching roles as well, which is really interesting as well, because you can kind of use your knowledge that you've acquired, you know, to teach other people, which is very exciting. You also have an industrial pharmacist. So these are the people that kind of work in companies that manufacture medicines. So you're kind of involved from the very beginning of like the design, the initial design of a drug, all the way to the end of when, you know, the medication is finally launched to the public. It's really exciting because, you know, you'll definitely be in the lab a lot. You'll be involved in research, you'll be involved in development, you'll be involved in clinical trials, you know, the production of the drugs as well. Is a lot of research, and you'll be working in a team as well. So it's a lot of data you'll be working with, like I said, in companies that manufacture medicine specifically. You also get the opportunity to progress into something called a qualified person, which is someone that has, you know, the legal responsibility of checking off a medicine before they're actually released. With this, I'm kind of going to delve into it a bit later, but you can actually, you know, there's summer placements that you can get onto if this is something that you are interested in, but that's something I'll speak about just a bit later. You also have a GP practice pharmacist. So these are the ones, so they work in the GP and they work directly with patients. So they speak to them directly, they treat and consult them as well. Their job is to kind of review how they're taking their medications and making sure that they know how to use their medications. So a lot of times, like they will have like a list of the patient's medications. They will have something called a medicines review. So they will speak to the patient, making sure that the patient knows what they're taking, knows what they're taking it for, knows how many times they're meant to take it in a day, you know, making sure that the dosages are okay for them, you know, kind of going through it step by step. So that the patient is comfortable in taking their medication. They can also progress to becoming, you know, managing a pharmacy team at the GP. So this is also, I feel like GP in particular is quite a new avenue for pharmacists, because it tended to be a lot of the hospital and the community, but now a lot of people are getting into GP practices and kind of, you know, finding their base there, which is really interesting. You also have something called an academic pharmacist. So being an academic pharmacist, you know, these are lecturers that teach and train future pharmacists. So they train, you know, all of us undergrads that want to study pharmacy. These are lecturers that have already become established pharmacists, and they are now coming to teach us. So they, as well as lecturing students, they are also involved in research. So they're actually required to be researching quite frequently. So they can, you know, be researching and discovering new medicines and finding ways in which pharmacy practice can be improved. So if you can see in this picture here, you know, they kind of work in a team, finding new, you know, new medicines and all that kind of stuff in the lab. Usually, most of the time, you can actually do this as part-time. So it's not usually something that's done full-time. A lot of times, these lecturers, they also tend to, you know, work in the community or hospital part-time. So it is something that can be done in combination. You can also progress into becoming like a senior lecturer or a professor, or even becoming like an examiner or making, you know, resources for students. So pharmacy can actually be quite creative. So you can actually be one that, you know, creates resources for students, whether that's like books or just, you know, workbooks for students, which can allow you to be a bit more creative in your role as well. So I want to speak a bit about independent prescribing. So with the year that has just started, so the first years that has just started, the MPharm degree has kind of changed in a way whereby before my year group, they at the end of the 4-year degree, you would do something called a pre-registration year. And in this pre-registration year, you're required to work, like have work experience for 1 year. So you can choose where you want to work. You can either work in a hospital, community, industry, GP, if you like. So in that year, once you've done that work experience, at the end of the year, you do an exam, then you become a pharmacist. So you would kind of have the choice to do independent prescribing if you wanted to, but now it's actually a requirement to do independent prescribing during your pre-registration year. So it's no longer called a pre-registration year, it's actually called a foundation year. So once you graduate, you will be a trainee pharmacist. And in that year of your work experience, alongside your work experience, you'll be training and doing your independent prescribing. So being an independent prescriber, it allows you to prescribe independently. So you'll be able to prescribe drugs. So right now as pharmacists, we don't prescribe anything. But with this course in particular, with the independent prescribing course, you'll now be able to prescribe drugs that is in your category as pharmacists, which is really exciting, because now it's integrated into the, MPharm degree, whereas before it wasn't, but now it's kind of compulsory. So summer placements. There are a lot of summer placements that you can do. I've listed some names here. So for industry in particular, if that's something that you find yourself interested in, there are really major, companies that, they take on students every year, especially for summer placements, such as GSK, Pfizer, Teva. We have all these ones such as AstraZeneca. You can literally jot these down if this is something that you're interested in. And usually people tend to put in their applications. The deadlines are quite early, so it's important to kind of always be checking them and put in your application as early as possible, to have the chance of kind of working for your summer in one of these companies. And during this time, you'll really be trained, and you have you'll gain insight into what it's like to work in industry, and you can kind of see whether you like it or not. And a lot of times, when you actually graduate and become a pharmacist and everything, getting into industry, a lot of people try to say it's hard, but it is possible. It is possible. And I'd say having experience such as summer placements is actually is more beneficial for when they see your application, because they're like, oh, okay, you've actually had a summer placement in industry before, so you're most likely going to get chosen later on in your degree. You also have hospital placements. Once again, every year students are always being picked out for this. So obviously this depends on your area and where you live. So these are a few, I think, so such as London and South East Pharmacy Hospitals, Chelsea and Westminster Hospital, South West Hospital, Guy's and St. Thomas. So depending on where you live, I would say really researching the hospitals in your area and see if they take on summer placements and take on students, and really try to see if you can get a placement there, because you really be able to gain insight, which will be beneficial for you once your degree is finished. And you'll also be able to see whether this is something that you want to do or not. Even during your MPharm degree anyways, you do go on placements throughout the 4-year degree. So even for myself, we have placements coming up, whereby I'll be doing 1 day in a GP, 1 day in a hospital, and 1 day in a community pharmacy. So I kind of know what I want to go into just by having those experiences. And in 3rd year, it goes up to a week. So we have a week in GP, a week in hospital, and a week in community pharmacy. So doing this actively, it helps me find my feet and see where I can fit in. For community and GP placements, it's best to visit them directly, because you can literally pop into your local pharmacy and be like, I'm looking for work experience, do you offer any? And they'll be able to tell you on the spot. And the same with GP, you can call in or actually go there and ask them directly, can I work for a short period of time with you, to just kind of gain experience, and I'm sure they'll be willing to help. So here are some other careers. So I didn't fit them all in, but there's so much more to pharmacy. So there's care home pharmacists, there's also cosmetic pharmacists, there's a military pharmacist, so you'll be able to, kind of work in the army, veterinary pharmacist as well. You can also be a scientific or medical writer. So this is kind of like getting into like journalism. You have the opportunity to be on radio or television, kind of medical communication. So you'll be able to help, you know, pharmaceutical industries kind of promote their products using marketing and education. So if you're into like creative stuff, you can actually embed it into your career. So, you know, using marketing, that's quite creative. You can make promotional products, promotional, things for companies that require it. You could also be a scientific proofreader as well. So being able to, you know, read papers and all these things, with your knowledge, you'll be able to understand it. So being able to proofread it would be really interesting in that way. And that's all from me. So I've kind of gone through the main careers in pharmacy, and there's quite a lot to it, but obviously you have quite a while to figure out what exactly it is that you want to do. I'd say with a lot of research and kind of going into searching out these companies that I've listed, you know, speaking to people that are around you, whether you have any other like, you know, pharmacists in your family or anything like that, being able to, you know, ask questions and see what it's like in that way, it would really be beneficial. I know you're probably wondering what's the salary like coming out of university. In terms of community GP, community and hospital, I'd say community starts off with the highest paid salary compared to hospital. So with hospital, it's kind of you have to progress, whereas with community, you have a higher salary at the beginning, like coming out of university. So yeah, that's what I'll kind of say with that, if any of you guys were wondering what the salary was like. But yeah, let me know if anyone has any questions. I'd be happy to answer any questions that you may have for me regarding pharmacy, regarding the careers or any of that sort. You could just pop them in the chat and I'll be willing to answer them. Does anyone have any questions? Could be literally anything regarding the careers, or have you been able to think about what you want to do? Has this kind of given you insight of the different careers in pharmacy? Have you kind of got a feel of what it is that you want to do, or, you know, has it given you any form of insight? Let me know in the chat. Has it been useful? Awesome. 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 That's amazing. Thank you so much, guys. Oh, got a question. Can you become a pharmacist through apprenticeship? No, you can't. So the most that you can do through apprenticeships is become a pharmacy technician, I believe. So you need the Masters of Pharmacy degree to become a pharmacist. You can't do it through any other avenue, unfortunately. It's literally only through university. Literally through, you know, I remember I was actually researching that. Yeah, you can't. No worries. Awesome. So if we don't have any more questions, I'm going to round it up here. Thank you all so much for joining us today. I'm going to pop the MetaB link website into the chat. We do have pharmacy services whereby we can help with your personal statements, we can help with interviews, you know, the application process as well. So do have a look on the website. Also follow the Instagram page as well, MetaB Consultants. And I hope you guys enjoyed today, and I hope it was useful for you too. Thank you so much for coming, everyone, and have a lovely evening.
Hey.
Hey.
Oh, hold on.
Oh, you're still recording.